Your spine is being compressed right now, and if you've spent more than 30 minutes sitting today, your discs are under 40% more pressure than when you stand. Every hour you stay in that chair, the cushioning between your vertebrae gets thinner, the nerves get tighter, and the damage quietly stacks up. Welcome back. Today we're talking about something that affects millions of people who sit at desks, do repetitive work, or simply live in a modern body: chronic spine degeneration and repetitive stress. The good news? There's a hands-on approach called manual therapy that can genuinely turn things around. By the end of this video, you'll understand exactly what it is, how it works, and what you can start doing today to protect your spine before the damage gets worse. Let's get into it. Here's something that might surprise you. Your spine isn't just taking a beating from big accidents or sports injuries. The real culprit for most people is the slow, silent grind of everyday life. Hours hunched at a screen. The same repetitive motion at work, day after day. The gradual aging of the discs that cushion each vertebra. Doctors call this chronic degeneration, and it doesn't announce itself with a dramatic moment. It sneaks up on you as stiffness in the morning, an ache when you bend over, or that nagging tightness that never quite goes away. And here's the kicker. When your spine is struggling, it's not just your back that suffers. The nerves running through your spine connect your brain to your entire body. So when things go wrong there, everything from your posture to your leg strength can be affected. So what exactly is manual therapy, and why are so many people turning to it for spine relief? Think of your spine like a finely tuned machine. If one gear is stiff, one joint is stuck, or one muscle cable is pulled too tight, the whole machine starts to malfunction. Manual therapy is like bringing in a skilled mechanic, a trained healthcare professional who uses their hands directly on your body to find what's stuck, what's tight, and what's out of alignment. It's not one single technique. It's a collection of powerful tools. There's spinal manipulation, that controlled movement that sometimes produces the famous pop sound, which is just gas releasing from a joint, not bones cracking. There's joint mobilization, a slower, rhythmic approach that gradually restores range of motion. And there's soft tissue work, massage, trigger point release, and myofascial techniques that relax tight muscles and restore healthy blood flow to the area. Here's where manual therapy gets really powerful, and where it's different from just popping a painkiller or slapping on a heat pad. The best therapists don't just treat your symptom, they dig into the why. Why is this joint stiff? Why is this muscle chronically tight? Is it the way you sit for 8 hours? Are your hamstrings pulling your pelvis out of alignment? Is your core too weak to support your lumbar spine? A truly integrated approach connects all of these dots. It combines manipulation for the stuck joints, mobilization to build flexibility, and soft tissue work to release the muscles holding you in a dysfunctional pattern, all tailored specifically to your body, your lifestyle, and your goals. The aim isn't just to quiet the pain. It's to restore how you actually move, so you can get back to bending, lifting, walking, and living without bracing for the next wave of discomfort. Now, professional care is powerful, but what you do between sessions matters just as much. Start by listening to your body. That mild morning stiffness? It's not normal, and it's not something to push through. It's a signal. Work on your posture throughout the day. Think about a string pulling gently upward from the crown of your head, keeping your ears, shoulders, and hips in one clean line. If you sit for long periods, set a timer and get up every 30 to 60 minutes. Even a 2-minute walk changes the pressure equation in your discs. Build core strength through low-impact movement, like walking or swimming. When you lift anything, even a bag of groceries, bend at the knees, keep your back straight, and let your legs do the work. And don't underestimate hydration. Your spinal discs are largely made of water, and staying hydrated literally keeps them plumper and more shock absorbent. If this video helped you understand what your spine actually needs, please give it a thumbs up. It genuinely helps more people find this content. Drop a comment below and tell me, where do you feel your spine tension most? Upper back, lower back, or neck? I'd love to hear. And subscribe if you want more practical spine health content every week. Also, if you deal with chronic stiffness or muscle tightness around your spine, heat and cold therapy can be a great complement to everything we talked about today. If you want the heat and cold therapy kit I recommend, the link is in the description. Your spine has been carrying you through every moment of your life. It deserves the same care and attention you'd give any critical system in your body. Start small, Stay consistent and don't wait for the pain to get louder before you act. As always, consult your doctor before starting any new health routine.